I'm Phil Atkins from the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin counties. You may know us as the We Care people. Creating safe and healthy communities is important to us. Communities where people who are experiencing a mental health or addictions crisis can reach out and get help. So we created a safety net that can provide intensive crisis intervention to anyone in Allen, Auglaize, or Hardin counties at any time, day or night. But like most safety nets, people never think about them until they need them. We know from our experience that mental health and substance abuse crises can happen at any time, and they're rarely scheduled from 8 to 5. We also know that more than 1 in 4 people will experience a mental health or addiction crisis in their lifetime. And each of those people has a family, friends, or coworkers who experience that crisis right along with them. More than 25 years ago, we established our Hopeline, a toll-free number that you can call at any time to get guidance on what to do if you or someone you love is having a crisis. In 2005, we created the We Care Regional Crisis Center, a place where anyone can walk in 24 hours a day, 365 days a year, and get immediate help for their mental health or addictions crisis, or support for their family member or friend who is in pain. You don't need an appointment, you just walk in. When there's a crisis, even the smallest details can seem like mountains. Simple things like, who do I call? What kind of things are considered a crisis? Where do I go? Where do I park? Which entrance do I go in? So here you go. The first thing we recommend is calling our Hopeline at 1-800-567-4673. It's easy to remember, it's 567-HOPE. Even though it's easy to remember, in a crisis it can be tough. So take a minute and program the number into your cell phone. You never know when you'll need it. The We Care Regional Crisis Center is located at 797 South Main Street in Lima. It's less than 45 minutes away from anywhere in our 3 counties. The building is located right next door to St. John's Catholic Church and across the street from Lima Towers. The location is secure and well lit, even at 3 o'clock in the morning, and parking is right close to the door. When you go in the main entrance, someone who knows what you're going through will be there to meet you. So what's a crisis? If someone's feeling very depressed or anxious, maybe they're having thoughts of suicide or harming themselves in some way, maybe they've been on medication to help them with their problems and have stopped taking it, and now things are out of control. It could also be that a family's in extreme conflict, and the fighting with a troubled child has gotten to the point that it simply can't continue. And of course, it's nighttime when everyone's usually closed. Alcohol and drug abuse are also affecting our communities in devastating ways. Maybe it's that moment when someone finally realizes that they need treatment because they don't think they can drink or use drugs one more day. When you go in, prepare to answer a lot of questions. We're sorry, it's just how it works. We need to know everything we can about your situation so we can help you find the best solution to your crisis. So what may happen? Well, one of our trained counselors will assess the situation and hopefully resolve the crisis or at least get you started. In our business, it's safety first. So if someone is thinking of harming themselves or someone else, we'll do everything we can to keep them safe. 2 years ago, we expanded the We Care Regional Crisis Center to include an 8-bed Crisis Stabilization Unit. The Crisis Stabilization Unit, also called the CSU, is a great place for people who don't need to be in the hospital, but need a little bit more supervision and safety. Our doctors, nurses, counselors, and social workers are available 24/7, maybe to help get your loved one back on the right medication or find a safe place to live. We hope this will take a little bit of the fear out of what can be a very scary situation. We provide many of our crisis services at no charge. When you're in a desperate situation, money should be the last barrier you should be thinking about. We're pretty proud of our safety net. We've worked hard to create it. This is the commitment of the Mental Health and Recovery Services Board to make sure that in times when you are most vulnerable, we're there when you reach out.